Ontario has a massive surgery backlog right now, but what if I told you that there was a very simple solution to solving it? And what if I told you that the reason that Doug Ford isn't going through with this is because he would rather put taxpayer dollars into the hands of billionaires and private corporations? This video was made in partnership with the Ontario Health Coalition. There is a massive amount of unutilized capacity in Ontario hospitals. And as Mike Crawley's CBC investigation shows, funneling tax dollars towards private corporations is only increasing the cost of surgeries in Ontario, with no evidence that it'll actually decrease wait times or increase quality of care. We have spent decades building our public healthcare system, so instead of trying to tear it down, why don't we do the smart thing and fund it properly? We have the capacity, so let's utilize it. For example, in Kingston there are 11 operating rooms, but only 1 or 2 are actually being used overnight and on weekends, with another 6 being underutilized at their other hospital. And it's the same case of the hospitals in Ottawa, with some Ottawa operating rooms actually being closed during the daytime due to staffing shortages. Staffing shortages that are caused by Doug Ford's underpayment of nurses and underfunding of the healthcare system. The exact same thing is happening in Cornwall and St. Catharines and in Welland, with the same thing happening in North Bay and massive examples of underutilization happening in London. And don't even get me started on what Doug Ford did to the people of Minden. But there is evidence that we can use our current infrastructure to solve the problem. In Toronto, Michael Guerin and Sunnybrook Hospitals partnered on an initiative to expand central intake for hip and knee surgeries. And this plan is estimated to reduce wait times in Toronto by 24%. We have the capacity, we have the solutions, we have the ability to make things better. Why is Doug Ford actively choosing to make things worse? The government could and should have opted to expand public capacity, but instead is choosing to go the more costly, dangerous, and slower route of expanding privatization. For our healthcare and all of our safety, we cannot afford more Doug Ford.